Hi, I'm Pete with PM Medical Products. We're a specialty medical equipment dealer based in Mountaintop, Pennsylvania, with showrooms in Wilkes-Barre and Whitehall, Pennsylvania. We do a wide range of products, but one of the main lines that we do is transcutaneous electronic nerve stimulators, which are more commonly known as TENS units. TENS units are designed to help people manage pain non-invasively and without using a pharmaceutical therapy. The TENS units work on a principle that is called the pain gate theory. The pain gate theory is one of the main theories on how to manage pain using a transcutaneous electric nerve stimulator. In 1965, Patrick Wall and Ronald Melzack came up with the theory that you can manage the pain by blocking it by sending a second electric message. The pain gate is almost like a train track where the pain is going up the track, which is your spinal cord, and then the conductor pulls the switch and it goes off to the side. So we're confusing the pain. The second theory is called the endorphin theory. The endorphin theory is a little bit different. When you think about pain analgesia before there were pharmaceuticals or TENS units, if you had pain in your wrist, you might take a spoon and tap on your wrist, and that releases the natural endorphins that will block pain. So those are the two theories in pain management. Now there are a wide range of devices. Many of them are digital and there are analog units, and the differences between the two are typically not much in as much as the wavelength and the waveform, but the way they're used is sometimes different. So the first one I'm going to show you is an analog unit, and what we do when we set these up is to open up the device. We put in a 9-volt alkaline battery. We then set parameters, and typically what we'll set is a pulse rate of 100. We'll put the device on M for modulating, and then we set a pulse width of 80. And it's quite simple to think about it. When you think about the pulse rate, it's almost like waves on the ocean. They can be kind of slow and rolling, or they can be really fast and sharp. We set them slowly for this device. Modulating, you feel the messages kind of going up and down. It's not just constant. And then the pulse width, you set either a narrow band of electricity or a wide band. For this particular device, we do set a narrow band of electricity. The next component is the lead wire. And the lead wires on these plug just into the top. There are two sides. You can set up either one set of electrodes at a time, or you can set up two sets of electrodes. The electrodes themselves are the sticky patches that you'll use to affix to the skin at the point where you want to send the messages. So to put these on, we're just going to plug them in like this, and now they are ready for application. So once they're applied, you're going to apply these typically on either side of the spinal cord, depending on where the pain is. Once they're on the skin, you're going to turn the device on with this knob and set intensity. Your therapist or your durable medical equipment dealer will set the parameters as I did earlier. Now there are other types of devices, some of the digital ones. This is what's called an intensity 12. This device has pictures of body parts. So if you have neck pain, you're going to press the button that shows neck, and knee, ankle, hand, back, and quite simply you just choose which one and it will send the program that's appropriate for that. This is another variety that also has body parts. When you turn this on, you will click to the appropriate body part. Now, TENS units are probably the most common and the ones that most therapists will prescribe. But for deeper pain, you can also use what's called an interferential stimulator. The TENS unit is a more shallow message, and it uses about 400 hertz. An interferential unit goes to 4,000 hertz, so it is a much deeper pain management. This device is what's called a twin stim, and it will do both interferential and TENS unit. You can switch back and forth. So depending on your pain, you're able to manage it by using one or the other device. That's about all I have to say about TENS units for today. You can reach PM Medical at 570-445-9214, and someone will be there to answer your questions. Have a great day.